What if I told you that your skin, your nails, or even your breath could whisper the secrets of your kidney health? Hi, I'm Dr. Mark, and I treat kidney disease every single day. It's far more common than most people realize, and most of the time, it hides in plain sight, with subtle clues you might be overlooking. In fact, up to 90% of people with chronic kidney disease, or CKD, don't even know they have it. That's a staggering statistic, highlighting just how silently this condition can progress. Catching it early matters a lot, because timely intervention can make a huge difference in managing and even slowing its progression, protecting your long-term health. So today, I'm going to walk you through 17 crucial signs of kidney disease that you can actually see or feel in your own body, often long before severe complications arise. If you find this information helpful, please take a moment to like this video, share it with your family, and subscribe to Happy Grandpa 69. What you learn here could genuinely protect someone you love. Let's begin with a quick refresh on our incredible, hard-working kidneys. You have two bean-shaped organs, perfectly tucked under your ribs at your lower back. We often think of them primarily as filters for waste products. And yes, they excel at that vital role, but their functions are far more extensive and crucial to your overall health. Beyond filtering, your kidneys are master regulators. They meticulously balance essential electrolytes like salt and potassium, maintain your blood's delicate acid-base balance, help control hemoglobin levels for healthy red blood cells, and are essential for keeping your bones strong. When these vital functions begin to falter, your body, in its wisdom, starts giving off clues. Let's explore the first visible one. Our first sign is foamy urine. I'm not referring to tiny, fleeting bubbles that quickly disappear, which can be normal. I mean a persistent layer of dense foam that lingers, much like the thick head on a freshly poured beer. This kind of lasting foam often indicates an underlying issue within your kidneys. That persistent foam frequently means protein, specifically albumin, is leaking into your urine. Tiny filters within the kidney called glomeruli normally keep this essential protein in your blood. When these delicate filters are damaged, albumin escapes, passing into the urine. Because albumin behaves a bit like soap, its presence creates that thick, long-lasting foam. If you notice this consistently, it's a key indicator for a doctor's visit. Next up is swelling, specifically what we call pitting edema. Here's a quick check you can do. Press your thumb into the skin on your lower shin, just above your ankle, for 5 seconds. If an indent stays after you remove your thumb, that's pitting edema, indicating fluid retention. This swelling occurs because when protein leaks out in the urine, blood albumin levels drop. This reduction causes fluid to seep into tissues, often visible in your legs, feet, or around the eyes, making them look puffy. Paradoxically, kidneys may hold more salt and water to compensate, worsening swelling. If swelling doesn't improve overnight or appears around your eyes, it's crucial to see a doctor promptly. Many people mistakenly think frequent urination, especially waking up multiple times at night, signifies healthy kidneys. Not so. The ability to concentrate urine is one of the first functions to decline with kidney trouble. Normally, kidneys produce concentrated urine overnight, aided by the hormone ADH. If you find yourself waking multiple times during the night to urinate, disrupting your sleep, this may be an early and important sign that your kidneys are struggling to perform this crucial concentrating function. It's a clue that shouldn't be ignored and warrants a conversation with your doctor about your kidney health. Now, take a close look at your fingernails, especially your thumbs. While a normal lunula, the little moon at the base, is perfectly harmless, half-and-half nails are often seen in CKD. This means one part of the nail is unusually pale, typically closer to the cuticle, while the other half appears a distinct reddish-brown color. The exact mechanism isn't fully understood, but the association is a real and recognized clinical finding. Kidneys regulate phosphate. When they fail, phosphate levels rise and bind with calcium, forming crystals. When these deposit in your skin, they appear as hard, whitish yellow bumps, sometimes breaking open and oozing a toothpaste-like paste. These lesions are often painful for patients and are a clear indicator of significant metabolic problems stemming from kidney dysfunction, signaling serious underlying issues. High phosphate levels can also cause blood vessel walls to act like bone, depositing calcium phosphate. This process transforms flexible arteries into stiff, palpable guitar string cords just under the skin, a condition known as artery calcification. This hardening of the arteries is a major risk factor for heart disease, increasing the risk of heart attacks and strokes. You may even see unusual calcifications on routine X-rays taken for other reasons, providing an unexpected, yet critical, clue about underlying kidney problems. It's a silent threat to your cardiovascular health. Damaged kidneys disrupt the delicate balance of phosphate, calcium, magnesium, and acid base. Hormonal changes, like increased FGF23 and altered vitamin D, eventually lower calcium and can cause painful nighttime muscle cramps. These are more than just a nuisance. They can be a serious symptom indicating imbalance. If you get sudden, persistent muscle cramps that aren't explained by strenuous exercise or dehydration, it's a good idea to have your electrolytes and kidney function checked by a healthcare professional. These cramps can be an important signal from your body that something is amiss, requiring investigation. Chronic kidney problems trigger secondary hormonal shifts, specifically high parathyroid hormone, which pulls calcium from bone. Over time, bones become brittle, leading to fractures or noticeable loss of height. This weakens your skeletal structure significantly, making you more vulnerable to injury. If you feel shorter than you used to be, or experience unexplained bone pain, it's crucial to get evaluated. This could indicate underlying kidney issues contributing to bone density loss and increased fracture risk, a serious long-term complication that needs attention and management. A relentless, whole-body itch that's worse at night, known as uremic pruritus, can be an early sign of toxin buildup or uremia. Patients sometimes scratch until their skin is raw, causing significant discomfort and potential skin damage, even infection. Uremic toxins and changes in skin receptors drive this miserable itching, which often signals advanced metabolic disturbance. Don't dismiss persistent, severe itchiness as just dry skin. It can be a critical indicator of kidney dysfunction requiring medical attention and proper diagnosis. That overwhelming urge to move your legs at night, known as restless legs syndrome, can be tied to iron handling and inflammation driven by uremic toxins. It's a common and frustrating symptom that significantly disrupts sleep and overall quality of life. When iron is improperly sequestered and dopamine pathways are affected by kidney dysfunction, restless legs become common. If your nights are frequently ruined by this uncontrollable urge, consider getting your kidney function tested. It's more than just an annoyance. It's a potential clue to underlying health issues. Some patients describe food tasting like pennies and breath smelling oddly like urine or ammonia. That's uremic breath, a direct consequence of waste accumulation. Saliva and oral bacteria interact with increased urea, producing ammonia-like smells and metallic tastes. This unpleasant sensation often reduces appetite, making it difficult to enjoy meals and leading to unintended weight loss over time. If you notice these changes in taste and breath, especially if persistent, it's an important symptom to discuss with your doctor, as it signals toxin buildup. Uremic toxins can trigger the brain's chemoreceptor trigger zone, a sensor that evolved to detect poisons. When activated by uremia, it causes persistent nausea, vomiting, and a marked loss of appetite, making food unappealing and difficult to consume. This combination of symptoms can lead to significant and unhealthy weight loss over time, further impacting your overall health and energy levels. If you're experiencing ongoing nausea, vomiting, or a noticeable lack of interest in food without another clear explanation, it's essential to consult your doctor to investigate kidney-related issues. Uremic toxins make platelets less sticky, so patients bruise more easily, have bleeding gums, or frequent nosebleeds. What used to be a tiny bump can become a surprisingly large and persistent bruise, taking longer to heal and fade. If you notice an increase in unexplained bruising or bleeding, especially from your gums or nose, it's another sign that your body's clotting mechanisms might be compromised due to kidney dysfunction. This requires careful evaluation by a healthcare professional to prevent further complications. This is rare but truly dramatic. In severe kidney failure, sweat can be so concentrated with urea crystals that it leaves a white powder on the skin, called uremic frost. This striking phenomenon is an unmistakable sign of critical illness and advanced kidney failure. Uremia can inflame the pericardium, the heart's covering, causing pericarditis, sharp chest pain, and a distinctive scratchy sound on auscultation. This is another late and serious manifestation of kidney failure, affecting the heart directly. Pericarditis is a potentially life-threatening condition, so if you experience new or worsening chest pain, seek emergency medical care immediately. One of the most common and debilitating symptoms of kidney disease is profound fatigue, often stemming from anemia. Kidneys make erythropoietin, EPO, which tells bone marrow to produce red blood cells, carrying oxygen throughout your body to all your tissues. When kidneys fail, EPO falls and anemia develops, leaving you constantly exhausted, weak, and unable to perform daily activities. Fortunately, treating anemia with synthetic EPO can significantly restore energy for many patients, improving their quality of life and overall well-being. The most dangerous truth: many people have no symptoms until CKD reaches stage 3 or worse. Often it's caught by routine labs, a creatinine rise, low eGFR, or protein in the urine. This silent progression is why awareness and regular checkups are so critical. That's why screening matters, especially if you have risk factors like diabetes, high blood pressure, or frequently take certain pain medications like NSAIDs. Early detection through routine checks is your best defense against the silent progression of kidney disease, allowing for timely and effective intervention. Beyond recognizing these signs, understanding prevention is absolutely key. The two biggest drivers of kidney disease are diabetes and high blood pressure, both preventable and treatable. Taking control of these factors through lifestyle and medical management is paramount for protecting your kidneys. Another common cause I see is chronic overuse of NSAIDs, ibuprofen, naproxen. Use them sparingly and check kidney function if you take them regularly to avoid unintended damage. Your kidneys do remarkable work, and they don't always give obvious warnings. Look for the signs above, listen to your body, and don't ignore persistent changes. Routine blood and urine checks can catch trouble early, when interventions make the biggest difference, protecting your kidney health and overall well-being for years to come. Don't wait for advanced symptoms. Prioritize your regular checkups and open communication with your doctor about any health concerns. If this video helped, please like, share with family, and subscribe to Happy Grandpa 69. If you want, I also have a follow-up that explains practical, evidence-based ways to protect your kidneys and lower your blood pressure naturally. Perfect next viewing. Stay curious, stay healthy, and empower yourself with knowledge about your body. I'm Dr. Mark, and I'll look forward to seeing you next time, right here, for more insights to help you live your healthiest, happiest life. Take good care of those amazing kidneys.